Hello, dear friends. This is Dr. Priya, Professor, Department of Oral Pathology, Anno Dental College. Now, this is a short video glimpse on mouth ulcers released in association with ID Tiruvalla branch. As we all know, we have different type of lesions occurring in the oral cavity, and one such common lesion which we all come across is mouth ulcer. Now, there are many type of mouth ulcers. And we'll just have a glimpse about the different type of mouth ulcers. Now, there is a commonly occurring ulcer that is especially seen in children, especially during the time of exams or when they are under stress. They are more commonly seen in girls when they are actually in their puberty or during their menstrual phase. Now, these ulcers are called as aphthous ulcers. So, they occur in relation to any stress or if you have any nutritional deficiency. So, these ulcers usually heal within around 14 days time period, and they are very, very painful also. The next thing what you can come across could be a manifestation of a skin disorder. So this is called as pemphigus. Now these are small, they appear as small vesicles which will rupture and leave an eroded surface on either on the palate or cheeks or even your lip region. Again, there is another kind of ulcer or eroded areas or red color areas which you call it as lichen planus. Now, this is also associated with a skin disorder or a dermatological disorder. They are usually seen as white color lines. Sometimes they appear as red color areas which are surrounded by these white color lines, or you can see them as thick white color plaques. The other things which you commonly see is, especially in children, is on the lips. Now these are ulcers which occur as a result of viral infection, and within the oral cavity they can be seen on the palate, and usually they don't appear as single ulcers, they appear as multiple tiny teeny crops of ulcers, a group of ulcers. Then you can see as a result of drug reactions. Now usually drug reactions will be seen on the lip area, and there'll be peeling of the mucosa. The drugs could be anything. They can vary from antibiotics to anti-diabetes or anti-epileptic drugs. So if such a case occurs and you get a reaction following a drug, it is always advisable to seek medical help. Then sometimes you can come across small reddish color areas. Sometimes you can come across thick white color areas. Now these you cannot close your eyes. It cannot be ignored. So if at all you come across these variants or these different types of white color areas or red color areas, immediately approach a dentist. Do not wait. And otherwise, you can get an ulcer. Suppose if you have a sharp tooth and the tooth is irritating your tongue or your mucosa, again seek help. And if this ulcer does not heal within 2 weeks, remember, if the ulcer does not heal within 2 weeks, do not wait. You have to meet the dentist, reduce the sharpness of the crust, and seek the next treatment, that is do a biopsy. So this is actually a part of cancers. If any ulcer is there in your oral cavity and does not heal, then remember it could be a cancerous growth. So do not worry about these different situations. Doesn't matter what it is. Do not do self-diagnosis. Do not self-medicate. It is always advisable to seek or to visit a dentist. If required or you are in doubt, please do a biopsy. And it is always better if you make a habit of routinely visiting a dentist. At least have a follow-up of all your oral hygiene conditions every 6 months. And remember, early diagnosis is always better. So if you diagnose earlier, you can do the treatment as early as possible, and the prognosis will be always good. If it is simple ulcers, doesn't matter. Keep yourself on vitamins, have a good healthy life, and have a good highly nutritional diet. So always remember, keep in mind, health is wealth. Thank you.